Hello, friends. So I'll be very briefly touching about this particular trial, which came in intensive care medicine in 2021. So it's a good study. So to look at the title of this study was viscoelastic hemostatic assay, which we'll call it as VHA, or TEG, what we call locally, augmented protocols for major trauma hemorrhage, a randomized control trial. It was called ITACTIC randomized control trial uh, done by the UK authors. So, so the aim of this study, basically they took all the trauma patients where major hemorrhage protocols are put in place. So the aim of the study was to see how these protocols could be optimized between doing two tests. So as friends, you would all agree that most hematologists subscribe to conventional coagulation tests, which is doing INR, APTT at fibrinogen levels. And this was compared to another tool, which is viscoelastic hemostatic assay, or what we call it as TEG analysis, to see which one performed better with regards to monitoring these patients and managing the major hemorrhage protocol. So that was the study aim. So this was a multicentric randomized controlled trial. So the primary outcome was to look at the patients who were alive at the end of 24 hours, who have received, who were free from major massive transfusion, which means to say any patients with trauma, they subjected them to these two tests after randomization, and they looked at the patients who survived at the end of 24 hours and who were free from massive transfusion, which means their optimization was adequately done by using this test. That was the thought process. Secondary outcome was to look at 28-day mortality. So in the results, they had randomized 396 patients. 201 patients received viscoelastic hemostatic assay as a tool to monitor their coagulation profile and guide the transfusion for these people, as compared to conventional coagulation tests, which had 195 patients. And the primary outcome is patients who were alive at the end of 24 hours and were free from massive transfusions, and where the transfusion was guided by these two tests. And as you see, primary outcome was 67% and 64%, and there was no statistically significant difference between these two groups. And 28-day mortality also, there was no difference between these two tests. So 25% and 28%, and there was not statistically significant. And they did a subgroup analysis. In subgroup analysis, they looked at patients with severe traumatic brain injury who were alive at 24 hours free from massive transfusion. Even in subgroup analysis in traumatic brain injury, there was no difference in the primary outcome, 64% and 46%. And serious adverse events, there was no difference. So that was the summary of this study. So the conclusions they made from this study was compared to these, when you compare between conventional coagulation tests and the viscohemoelastic elastic assay, so major hemorrhage protocol, when this was incorporated in the patients where major hemorrhage protocol was put in place, there was no difference in any of the clinical outcome indicators. So the conclusions we can make is we can stick to conventional coagulation tests, which we tend to use as opposed to the TEG or viscoelastic hemostatic assay. So whichever is comfortable, one could use, but most hematologists, as you would agree, would vouch for sticking to the conventional coagulation test, which most ICUs sort of do for these trauma patients. So that's the gist of this. So if there are any questions, you can reach me out on my YouTube or on my website, www.drpradeeprangappa.com. So thank you, one and all.